You know, we do always have a fair bit of announcements to go through until we get to the meat of the meeting. So hopefully folks will drift in as we go forward. My name is Sarah DeSilvi. I am the Director of Clinical Informatics for the Gravity Project. We'll be covering a lot in this call. It says Housing and Transportation Data Concept Review, but when you get to the agenda, you'll see it's quite robust. Next slide, please. We do want to welcome everyone for joining the Gravity Workgroup meeting. Everyone is muted upon entry just because there are so many members of the call. The call is being recorded. And the recording will be available on the Gravity Confluence page following the call. We do try to do a really thorough job of working the chat. So if you have questions, then please just send us a message in the chat and we'll try to integrate it into the call. We do want to say very clearly that if we fail to address your question on the call, we're committed to answering those questions. So please send us a follow-up email at the Gravity email if you feel like a question that you had in the chat needs to be addressed and it was missed or overlooked. When you are sending chat messages, please do try to send them to everybody so everyone can see them and everyone can respond. Next slide, please. This is just standard antitrust practices we have to announce. Next slide, please. How to participate in the project. If you've not already done so, we do invite you to officially join the project here. As we go through, we're going to be trying to put the links that we're talking about in the chat stream so you can link them directly. If you want to check whether you've already signed up or if others from your organization have signed up, you can also review that there. And then the Confluence is, of course, a massive array of information regarding the Gravity Project, including information on our technical initiative and our work and our domain initiatives and current homework and projects that are going on and public announcements. It's quite robust. Next slide, please. This is an ongoing list of our project funders, grants, and in-kind support that we have to date. We are incredibly grateful for the growing number of folk who are part of our collective labor. Next slide, please. We always, so we're trying to, always looking forward and trying to make sure that we are on stable footing. So if you are desirous of supporting our 2020 or 2021 work, you can always follow the link and it'll take you to information about how to become a Gravity Project sponsor. Okay. Next slide, please. The Administration for Community Living Challenge Grant, you've seen that we've announced this every single meeting. We just want to remind folk, registration for phase 1 is due December 14th. It's at challenge.gov and it's updated and you can follow the link there. And again, it's some innovative ways to test technology solutions for social care referrals. And then there's a link to the webinar about the grant you can follow there as well. I'm trying to sub for Evelyn on these slides, so she'll let me know if I'm doing okay. Next slide, please. We were lucky enough to join many of our colleagues and friends in a social determinants of health workshop on September 21st. You can see the agenda, and there's a recording to follow if you desire to see what our presentation was. We were doing the 40 to 1 hour video time frame. Next slide, please. So this is the agenda as it stands. So Gravity Roadmap and upcoming domains. I'm going to be pinch hitting for Evelyn here. Project schedule and terminology build approach. This will be myself. And then I'm going to be going through all the information on the domains. I asked the amazing the transportation insecurity subject matter experts to help us with the adjudication. So we're not focusing too much on transportation insecurity concepts today, but we have some things to present. Then we're going to give a brief update about future domains to come, and then I'll hand over the mic to Bob and Mark to talk about the technical direction and the USCDI submission, and we'll close with the community homework and next steps. Next slide, please. So this is our updated Gravity roadmap. We try to give a kind of visual overview of how all the different domain work streams overlap over 2020 and 2021. You can see the domains that we've clearly already defined, including the domains we're completing, such as housing instability and homelessness and inadequate housing. Going forward, you can see transportation and financial strain and further elements, and all of this is coinciding with the technical work stream and the technical initiative. And again, Bob will go into that in detail at the end of the call. Next slide, please. Just for the sake of clarity, I'm always trying to make things easier to understand. So I hope this helps. So I tried to step back and just kind of give an overview of the domains we've covered and the domains that are in process that are reflected in that timeline on the page before. So in 2019, we covered food insecurity. In 2020, housing instability and homelessness, inadequate housing and transportation insecurity. For our new focus, which is specifically on screening and diagnoses, trying to aim for screening questions and answers and ICD-10 diagnoses and SNOMED CT problem list codes, we're going to be focusing on financial strain, education, employment, and veteran status through the end of 2020. The goal is to meet the early December 4th ICD-10 submission with all of those concepts you see in that blue box. Then, in 2021, we are hoping to continue on some of our domains and focus and continue the goals and interventions work. And as we've mentioned in the past, hoping to slow it down a little bit so we can really make sure we're addressing some of the community needs and some of the infrastructure needs and some of the interoperability needs. We need to build that terminology well. And then you'll see some new domains of social isolation, stress, and interpersonal violence. And again, those 2020 new domains will focus again on screening and diagnoses, and will collectively define together if we want to continue goals and interventions on some of those domains. So that'll be a work in progress, it'll be a group decision, and we'll go forward on that together. But again, by 12/4, the goal is to submit to ICD-10-CM Coordination and Maintenance Committee meeting for the March meeting, an ICD-10 application for everything in the blue box. Next slide, please. And then I just wanted to make a note of every time we put something in the parking lot or talk about it on the call, we are keeping note. So just because everything on the slide we just saw before is defined, it doesn't mean we've neglected or forgotten everything as we've been talking about over the course of the last year and a half and almost 2 years. So these are things that we know we've defined as necessary. We just need to build together on the timeline together, including concepts of racism, neighborhood safety, food access or food apartheid, home accessibility and adaptability, and infrastructure and equity. So all of these things are kind of just, we'll collectively shape and put into our timeline together as we go forward. Next slide, please. So here is our to-do list and schedule and homework if that's the goal. Remembering we're trying to focus on getting a diagnosis ICD-10 submission in by December 4th for everything in that blue box. Here we are on October 1st, where we are finalizing housing instability and homelessness consensus voting. We're beginning end-to-end review for inadequate housing, focusing on screening, questions and answers, and diagnoses. We're reviewing some of the submitted transportation concepts, and we're briefly talking about financial strain because we kick off that at the next call. So your homework is to submit those votes. Some of the folks on the call I know, I was looking at the committed members who haven't voted. Some of you on the call, if you have not voted yet, please do so now. We need 40 votes before we close out the set, and we only have a couple days to do that. Of course, we'll extend it if we have to, but we're hoping to get those 40 votes before the end of the voting session. We also are going to be asking you to review and submit concepts on the inadequate housing master list. You'll see that at in the call today, and then submitting transportation concepts and financial strain concepts. Okay, onward. And you can see up here, so by 11:12, I just want to take us ahead for a little bit. This is when we're hoping to get our voting kicked off for the transportation and financial strain elements in order to meet that December 4th deadline. Next slide, please. So again, this is just our meta, how the SDOH domains and terminology intersect with the technical work of FHIR. visual. It's kind of a ground setting that we do every time. Before I go onward, I know there's a question and answer slide, but are there any questions on the schedule as it's posted? Understand the schedule will be on the Confluence, the slide will be available. But is there any questions so far on the approach or the schedule as it's outlined so far? Anything in the chat? Any questions? No? Okay. You can always put a question in there and I'll do my best to respond, as you know. Okay, next slide, please. So this is the visual, again, level setting. So each of these icons kind of correlates to a different phase of our work, the pre-work, where we are with financial strain, identifying concepts, that's where we are with transportation, reviewing, that's where we are with inadequate housing, voting, that's where we are with homelessness and housing instability. Build is where we are with food insecurity because we're going back and forth with SNOMED and LOINC and ICD-10-CM. And then comes test, evaluate, and all of that feeds back to make sure that we're actually refining and massaging the codes that we've suggested as hypotheses together. Next slide, please. Okay, any questions at this time? No? Okay, here we go. Next slide. So, consensus voting on housing instability and homelessness. Next slide. Again, grateful for all of our housing data element submitters. A special shout out to WellSky, who was very patient. We forgot, we neglected their icon, one of our previous slides, and Gabe was very kind to remind us. Very grateful for WellSky's collaboration in the HMIS subcommittee. Next slide, please. So here we are. So we are 40 votes out from completing the number we need to get to consensus. So please, those of you who are committed members, if you could follow, I know I feel like I'm doing a telethon every single time I do this, but please vote. It's only 40 of you. So we're trying to push the blast out through social media. It really is the final step of committing to this labor is if you're a committed member, getting out your vote and putting it in the system so we can count it. It is a pledge drive. It is, yes. Maybe we can have matching votes, but no, that doesn't work that way. So we only need 40. So I'm sending out personal emails to individuals who are committed members who haven't voted. And again, I have a list right now. So if you vote and I still send you an email, I'm sorry. And next slide, please. Again, the dispositions for voting are yes, no concerns, as it is, all good, yes with comment, and all those comments are reviewed by the team and then integrated, and if something's critical, we bring it back to the group. Formal objection means absolutely not, stop the presses, and abstain means the member declined. Next slide, please. Lucy Johns is asking why aren't people voting, and I think probably the number seems small enough. You think someone else is going to do it, but we definitely need everybody to vote. So make it be you. Next slide, please. Any questions? I have to wait. That's wonderful. So Carrie, thank you. That sounds great. Again, so we have some time. So we also are forgiving. So try to vote before the end of the week. And if you can't, and you just let us know, Carrie, if your folks haven't chimed in yet, you can send us an email and we'll just know that it's coming. Next slide, please. Okay, so reviewing inadequate housing concepts. So this is when we take a focused look at the information we have so far. And then with a request that you download the master from the master list, and review it and submit comments. Next slide, please. So this is the running tally of the number of submissions we received and the dispositions for each of those submissions. You'll remember each element submitted has a formal disposition. It's either added, or we determine it to be a duplicate or synonymous, or we determine it to be not relevant for the domain but needs to be parked, or we say just do not add, or we ask for more information from the submitter. Next slide, please. So again, we spent months winnowing and adding, and so these are the questions we have to ask ourselves in the end-to-end review. Are there missing concepts? Are there incorrect concepts that need to be changed? Are there concepts that are unnecessary and should be removed? Again, I want to give a special shout out to Karis from 201 San Diego, who offered a focused review of the inadequate housing data set. Very, very grateful for her leaning into this set because it was pretty slim. Next slide, please. You submit the comments because on Monday, the 5th, you can download the latest inadequate housing master list. There's a little bit of delay from the call each time, just because there's last minute additions every single week, and we have to give the amazing Linda time to integrate all those additions. So it comes on the public Confluence on the following Monday. And you email any comments regarding data elements to gravityproject@emiadvisors.net. And you, again, ask those questions. So if it's on the master list, we want to know the element ID and the reason you feel like the element's inappropriate. Or if it's not on the list, we want you to submit the data element type and include a description for the data element you propose. And then if you have additions that you feel like are important and they're a screening question and answer, please attach a copy or link to the tool to make it easier to add them and adjudicate them. All comments regarding screening and diagnosis submissions are due October 30th. Next slide, please. So currently as it stands, these are our inadequate housing screening questions. It seems slim, but the American Housing Survey is quite large. So we have the American Academy of Family Physicians Social Needs Screening Tool, the American Housing Survey, the Accountable Health Communities Health-Related Social Needs Tool, the Medical Legal Partnership Screening Tool, and this is the core tool that you see across the Accountable Health Communities tool. That's the Naruzaman et al. Tool. We have the Upstream Risk Screening Tool, the Medicare Total Health Assessment, the SDOH tool, Community Health Central Washington tool, and then another CHFC SDOH all domain tool. Again, email any comments. And all of these are available on the Confluence for review. We do this little kind of simple summary that you can get on the Confluence because the master list can be a little overwhelming. Next slide, please. And again, these have not really changed since we refined them together earlier. So these are the diagnoses as proposed. So you would have the meta concept of housing does not meet jurisdiction habitability standards or substandard housing. And then in SNOMED, we built all of these sub-concepts: substandard housing due to pests, substandard housing due to mold, due to lead, due to temperature control, due to inability to store or prepare food, due to lack of smoke detectors, due to lack of potable water, or due to overcrowding. Remember, we're choosing the substandard framing to allow for regional variabilities in what is considered normative, right? And again, we always go back to the Hawaii example, right? What's a pest in Hawaii is different than what's a pest to me in Vermont. Next slide, please. Oh, garbage disposal. Oh, so maybe you had a comment, Lucy. So send in an email. Garbage disposal? So Lucy, I suppose if you mean disposal of refuse versus a kitchen garbage disposal, just send an email and help me understand what that means. That'd be great. I'm sorry, the phone's ringing here. Questions? So Mike Klinkman is asking about asbestos exposure. I do feel, I was actually just talking about this concept with the Office of Minority Health, needing to really specifically, it was actually Amy Conrick was talking about asbestos exposure, needing to specifically consider outside of the HUD inadequate housing survey framework, toxins within the home. And so I think we need to put our thinking caps on and see if things like asbestos exposure and lead exposure, whether we need to add asbestos exposure to this concept or whether we need to consider it in a future concept. But let's consider that added, and then we'll mull it around and go from there. And then structural deficiencies, let's consider that added as well. So I'm wondering if we can just, so Mike, I'm taking that as a comment to consider adding structural deficiency to the framework as we have it so far. Is that correct? Okay, yep. All right, can we just quickly go back a couple slides just to look at the diagnoses as they stand? Thank you. I'm sorry. I know it's hard. So we have lead on there. All right. So what we'll do is we'll parse the chat, and then we'll bring back as collective comments from the chat as we do. We'll make a submission, and then they'll be adjudicated into this diagnoses list. Thank you so much, everybody. It's funny, you think you're set, and then suddenly this is what we do this for. Next slide, please. So any other comments on things that are critically already missing before we go on? Lack of mail delivery. So what we have sewer septic from Carrie Nichols. So one of the things we're thinking about with mail delivery is in the a future domain. I don't know if you guys saw it ever so briefly in the defined but to be placed on the timeline are the infrastructures and communications that wrap around homes, like things like broadband, mail capacity, even though mail is fairly universal. But we had that brought up before and thought about that being in that bucket, but we'll consider it. We'll think about how that fits, though. Lucy, does that make sense that it would be close to considering broadband? Great. Okay, great. And then Christine says, agree with structural deficiency. We had a huge windstorm too. Okay, got it. And of course, I mean, third ward post Katrina noted, right? Yes. Okay, this is fantastic. Look at this. Okay, so we'll review, we're going to review these concepts and then add them and then bring them back to the group next meeting, because we'll talk about the end-to-end review comments for diagnoses and screening and discuss goals and interventions. Does that sound good? I'm going to take it as a yes. There's a lot in here in the chat. Looking forward. Okay, lovely. Next slide, please. Okay, just some concepts regarding transportation insecurity. We have some things that we've already adjudicated and added. I'm wondering for time, it seems like we actually, does anyone need to talk about housing anymore, inadequate housing anymore? Because we do have a little bit of time. Is there anything that was not said regarding inadequate housing that people feel like needs to percolate? Age-specific hazards such as lead, structures, elders, others. Okay. Just drop me an email if you feel like there's something, you have an epiphany that you want to include. Some housing issues are regional, 100%. Yeah. This is hopefully with offering the substandard framing that allows for perspectives of individual sufficiency and regional sufficiency. Yeah. Yes. Then there's the natural disaster element. So Mark is commenting on the fact that sometimes the intersection of home structures and regional, national, like natural disaster capacity makes for housing being not necessarily habitable in one place that would be habitable others. Yes. Okay. Any other thoughts from the group before we move on to transportation? I see animals in the home is important. Yes. We've actually had that concept before. Mold was mentioned. Yeah. Let's go back one more time because it's only 4:24. Again, Linda, I'm sorry. Can we go back just a couple more? Just one more time. I want folks to sit on that for a couple seconds. So this is what's here, right? So we have pests, mold, lead, temperature control, which is wide enough to be heat or AC, depending on the requirement. Inability to store, prepare food, lack of smoke detectors, lack of potable water, and overcrowding. And then we have everything that's been added so far. So we have the structural insufficiencies, which I think is broad enough, but it's actually not contained in this current set that we've heard. We've heard asbestos, which is clearly missing here. And then I'm going to agree with Carrie Nichols that hoarding is more of a health behavior. It actually is a diagnosis. But wondering if there's a way to capture the concept that could marry with hoarding as a diagnosis and a housing representation in order to define the interventions that were required. And then we had access issues. Yeah, like safe steps and all of those elements. Okay. I think any other comments before we move on? I think this has been very, very helpful. We have sound management. Yeah, so we also have this comments about housing adequate at the locations near a waste treatment highway industrial plant. So those kinds of elements, again, are what we are imagining as being really, really important into that defined and yet not put on the timeline yet intersection of the individual and their surrounding environment element. Also are elements of like neighborhood safety and food apartheid. So that those kinds of concepts, like the place where my house is unsafe because of those reasons, we are seeing being within the 2021 work just from a consensus rings perspective. All right. Wow, this is a very, very vital chat. One of the things we did mention also, and I think we can see this in some of the comments here, is specifically focusing on the intersection of individual abilities and housing as outside the HUD approach and specific to like ADLs or accessibility. That is on, so far, we are conceptualizing that as within the next phase of work. Because it's not just the structure itself, it's the intersection of the individual's abilities and the structure, but maybe we should look at that again. We did have a section for that in our timeline, which was about housing meeting ability and accessibility, like things like ramps and lifts, etc.
Sarah?
Okay, yeah?
I wonder if the term jurisdiction is influencing or needs to influence what we think about when we think about habitability. Does jurisdiction imply that the things that we want Snowbed to account for have to do with local law? Or can we delete jurisdiction and then take account of this great richness that's overflowed in the chat?
We absolutely can. I think that that's a really great recommendation. I still feel that some of the things in the chat are not just about the house, right? And so we have made approaches to think about elements. Like there was a really wonderful conversation about older adults in their homes, right? And what inadequate housing meant through that lens. Again, I think that was like 2 months ago.
And that was probably me, Evelyn. This is Dan Anderson.
Oh, yay. Wonderful. This is Sarah, by the way.
Oh, I'm sorry.
No, it's great. Okay, so I've been trying to mentally find you. So it's great that you piped up again. I was like, that person, it was really all you, and you offered to help. So far we've imagined that as a subtype of inadequate housing. And we can reconsider that. But some of the things we're seeing in the chat right now, I think kind of fall into that lens. But maybe we need to think about that again and reapproach it. And maybe, Dan, if you want to talk to me about that through you can find me via an email, and then we can have a specific conversation around that.
Yes, let's do that. Okay.
A discussion of intersectionality would be excellent. Yes, exactly. It is true that the intersectional lens is critical when we're doing any of this work, and this is the hazard of trying to sort things, right? As you get in trouble, and it's awkward and imperfect. Any other thoughts? Rural New Mexico has little home delivered mail. Yes, that is very true. So again, we're imagining so far, and maybe what I'll try to do is, if, for instance, we have named some of the things in the chat as not being part of inadequate housing, what I promise to do the next time we meet is to match those things with where we're imagining addressing them in the coming year, and getting all of your feedback. I think that seems like a good approach. So it's not just punting things down the road, that we're actually matching them. Does that sound good? Oh, yay, wonderful. Okay, so Carrie's we have a new member and she's enjoying the conversation. Fantastic. And then Carrie's giving me a thumbs up for not just punting. If something's been named, what I'll try to do is match it to our future plan. And then if we can't match it, collectively have you all help me figure out where things go. Yes, oh, that's great, Lucy. Okay, any other questions before we move forward? We really spent the most amount of time on the thing that we actually had to cover today, given the slimness of this set. So I'm really, really grateful. Next slide, please. And then we already covered questions. So next slide, and then next slide. Okay. So we did clearly adjudicate the screening questions and answers element. So we do have dispositions for those. We have a little bit of review to do on some of the goals and interventions. For transportation, remember we did kick off transportation insecurity last meeting with our amazing and growing list of subject matter experts. So when we come back next time, I'm going to make sure that I pass the mic to all of them, but I did ask Jen and Alex to do the adjudication this week. So I volunteered to lead just a quick review of screening questions and answers. Next slide, please. So as usual, when we get into domain for the first time, I try to give an overview of the ways we screen for these things in clinical and community settings. So these are some of the core existing questions that we've all adjudicated as being to add into the master list. So you'll see these questions bloom onto the master list when it's published soon. So the prepare question: has lack of transportation kept you from medical appointments, meetings, work, or from getting things needed for daily living? Or are you worried about getting to work, school, groceries, or appointments because you don't have a way to get there? You can see each of these questions include some of those concepts that Alex and Jen were talking about last time, where there's the medical appointments elements, and there's also connection to the vast other elements that comprise a healthy and well life, right? And then there's the health leads question, which is specifically medical focused. In the last 6 months, have you ever had to go without health care because you didn't have a way to get there? And then there's the WellRx question: do you have trouble finding or paying for transportation? Super broad, right? So there were other questions that we all agreed to be additive, but we just did a summary here to show you some of the range of the domain as it's starting to demonstrate in front of us. So we have the simple having a hard time paying for, and then we have the destinations coming in as well, whether they be just healthcare destinations or all the different elements of a life. Next slide, please. I think, so again, when it comes to brainstorming for folks who might be new on the call, and for Jen and Alex, I put in a car icon for you. I took the food one out. So when we're thinking about brainstorming and submitting concepts, we want to ask ourselves questions. What kinds of data does the provider need to care for their patients? The hospital need to study the effects of provider interventions. A community-based organization or a vendor or service provider need to address the needs of their clients. The state need to plan for population health needs, and what are the principles we need to consider to keep patients at the center? Lucy John says, how about people getting to you for in-home health care? That is an interesting consideration. I will put that in the head of the people who know transportation better than me. That's interesting. I'm thinking about that one. Informal home health, yeah, interesting. Okay, Lucy, you have such good. You're so good at that. Next slide, please. When you're submitting transportation concepts, again, there's one slide that we usually have in here that that I think I forgot to put in this time. I'm just going to say it out loud. Remember, we're thinking about screening questions and answers. We're thinking about potential diagnoses. We're thinking about potential patient goals. And we're thinking about the programs, professions, and people that assist our individuals and our clients with those goals. And then Jen's adding another thing to consider for brainstorming. What does the managed healthcare plan need to capture transportation insecurity since they're often administering? That's a lovely idea there. And then transportation for social support might be a concept to consider. Thank you, Lucy. So if you follow the link, that is the way to submit concepts for transportation insecurity. As always, we're also very accessible. So if you just want to send an email with an idea, we can do that, or you can just drop it in the chat. What we'll try to do is add elements such as this that are coming. If there's critical things that we're missing from a perspective finding, we can add them to our future slides. Next slide, please. Any questions with transportation insecurity submitting concepts? Again, there's the Excel spreadsheet you can download. We'll get to that at the end of the call. You can send an email. You can write me an email. Anything we can do to get concepts in there. And I do want to state very clearly that we really appreciate each of you utilizing your network to get submissions. So grab the link from Confluence, disseminate it via your networks through social media. Say we're searching for transportation insecurity concepts regarding screening questions and answers, diagnoses, goals and interventions, and then let's see what happens. And then just send it all back to us. Next slide, please. Yes, I think, yeah, we have, that is an interesting consideration. So things like, so what we'll do is we'll have that be part of, just like we were having the inadequate housing chat be part of, to be reviewed. This will put on a chat submission for transportation security, and I'll let the brilliant subject matter experts hem and haw over that one. Proxy, yes, says Lucy. We put a little timestamp here just for financial strain, just because as per usual, we try to give everyone a heads up so they can start submitting concepts ahead of the kickoff next week. Next slide, please. I'm actually going to pause though. Any other questions from transportation? I'm sorry, there's a lot in this call. I want to make sure folks have considered transportation. We just gave you a tease, right? We gave you those questions that we've adjudicated so far. Oh yeah, so this is, these are all, so Jen's saying, read with all the comments. On the kickoff, we had all these use cases. So Jen's reminding us of the use cases that they presented in the kickoff call. So each of those, with the use cases, we'll use those to help make sure that we're building the appropriate diagnoses, goals, and programs into our data framework. Mary Ellen Rose is asking a very practical question. Are all of our meetings always on this day? Yes. Are they always at this time? Yes. And are they weekly? No. We meet every other week with our public call. I do want to state, though, very publicly that given the heft of labor that we have going ahead of us before the end of the year, it might be that we need to meet weekly in order to complete everything. So we've talked about that in the past as possibly needing to meet more often to get more done. So we'll collectively kind of take a pulse and see if that's necessary. And then Mike is putting a plus to mobility to see what we might be missing interventions. Sarah, please confirm whether you want the new data element submissions for financial strain to be only diagnoses and screening. No, everything, please. Because as mentioned, even though you saw screening and diagnoses as necessarily aiming for the December 4th work, we are hoping to continue our work with goals and interventions, and financial strain is a perfect one to include in that work. And then someone is asking, I'm just going to put the mobility question in the mind of the subject matter experts. I have the luck of meeting them after this call. They're very patient. They spend some time with me. And then Lucy asked me to define strain outside. I promise that we will in the kickoff. I promise. And then Serena Mack asks, are we capturing when transportation is relying on another person? That's interesting. So independence versus dependency. We will put that in our hopper. Because again, if you remember, those of you who are on the call with housing instability, whenever there's not a gold standard spectrum tool, such as the USDA food security module, we can't say, with food insecurity, we could say mild, moderate, and severe. With housing instability and homelessness, we had to define all the different subtypes in order to create a full diagnosis set. And so we are going to be in that same water this time. So all these different considerations, like dependency on other folk, it's really important as we kind of mull on the final diagnoses list in order to make sure it represents the breadth of the domain. I think that's all the questions. Thanks for cutting edge. Alex King, yay, hi Alex. I've seen pros and cons to using mobility versus transportation, depending on the audience, but great point. So you can see it in the chat. Alex and Jen Sistogal, who are two subject matter experts, being more intelligent than I on this. And if you ever want to unmute and just talk, please do. I'm a corraller. Any other questions regarding transportation? And again, I hope I answered Evelyn's question. When it comes to submission of concepts, the submission is for all of the concepts because we will get to them in time. Get to goals and interventions in time, but focusing on reviewing and voting on the diagnoses and screening questions and answers before December 4th. Contact your financial colleagues and bring them into the fold. Yes, and if you look ahead, again, part of what we want to do is take responsibility for bringing folks who care about this work into these meetings and getting their, and even just facilitating their engagement if they can't come. So using your listservs, getting the message out there that we're working on these things. And if you want tips or tricks about how to communicate out with our labor, just send us an email, and we do this all the time. We're happy to send you text about what you could send to your listservs and your working groups regarding any of these domains, and in order to get feedback back, including like the link to the Excel spreadsheet, easy ways to submit codes. We're here for you. All right, so what we'll do is, I hear the text would be great. So Carrie specifically, we will send you text on it. And then there's an intersection of housing and transportation. For instance, a person cannot access transportation until security. Yes. I'm wondering, just from a sake of time perspective, I wonder if you could email me that comment regarding the intersectionality, or you can, I think we have time. Do you want to unmute yourself and just try to speak to what you're talking about so that we can hear you? I want to hear what you're saying. Just regarding the intersectionality of housing and transportation.
Good afternoon, Sarah. Can you hear
Hello.
me?
Yes, we can. Hello.
Perfect. It's Hasna. So,
hello.
Hi. So, I live here in New York City, and I've grown up seeing, hotels converted to transitional housing, SROs, things of that nature, and as well as, been through to several public housing projects. And sometimes you may feel trapped in your home because until maintenance or until security kind of does a walkthrough, there are, people sleeping in the hallways or the staircase, or there is, undesirable materials on the floor in the elevator. So this is where someone may say, I can't get to work, and I cannot arrive to work on time, because for me to leave my house before this time, I put myself in jeopardy. Or for me to leave at this time, I have to expose myself and my children to these. Or it could be, I'm approved from for a home health care aide, but he or she will not arrive until this is addressed, right? So you have these obstacles in which, and again, like I said, it crosses many things, but the earliest train, the earliest bus, I'm willing to catch it, but how do I get from my home to the bus stop safely? Or the bus stop is unsafe, right? Because, there's a bench there, so there's shelter there, and that's where people like to congregate, right? So you have these obstacles that prevent you, as well as the members of your family, from getting from your home, because your home may be adequate, right? You may be absolutely happy with what you have, but it's that space in between the two safe destinations, right? For both you and your children or the elderly family members.
That is fascinating. It makes me think about, so we talk often about the overlapping complexity of all of these things in the human experience, right?
Correct.
So as we try to sort them, we've even mentioned this on this call today, there are the nuances of those can get lost in that sorting. I'm going to put that in the thinking cap and ask our lovely SMEs to weigh in on that. We're going to talk in a bit, and I wonder how, if it's happening outside of the door of the home, whether it would be best contained in the neighborhood safety elements that we are buildings and apartments and homes and rurality and urbanity. I mean, all of that noted, all of the complexity of that. But
yes,
we've heard you, and luckily I have really smart people, but smarter than me, who can help me sort through all those things.
Okay.
That was really helpful.
I'll end with one thing, Sarah. Last year when I was teaching for CUNY, one student said to me, my father has, a mental diagnosis, and he can't tolerate large crowds. So I need to figure out a way to get him to a train station with the least amount of people so that he can go to work. Right. So you can get out your house, you're safe on your block, but then your nearest bus station, train station, is not necessarily safe or conducive to your mental health.
Yes.
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 So when
Thank
you say,
you.
and I've been listening to everyone, it is based upon where you are regionally, right? So some people may not encounter this based on where they're located, whereas others like, oh yeah, I've seen that bus stop, or I've seen that train station, and I would never stop there. I would never, I'd never even take that bus route.
Yeah.
So just kind of giving you a sense of the barriers that exist for individuals.
I really look forward to collectively thinking on that well, and probably writing you a direct email.
Sure.
We
Not a
can have a
problem.
conversation.
Absolutely.
That is so important. Thank you so much. It was really very helpful.
Thank you.
Grounding, I think there is a momentum we have to keep to try to, again, do the sorting and do the building and the structuring, and this goes there and that goes here. But any moment we can collectively take to kind of sit in, again, this intersectionality of individuals' experiences is grounding and necessary. And thank you for taking us there. That was really good.
You're very welcome. Teaching at a community college has taught me so much. So
Yes. Thank you.
You're very welcome.
Thank you. Okay, that was very helpful.
Let's continue. I'm enjoying myself.
All right, so I think that's actually the end of the terminology work, and I'm about to pass the mic off to Bob, correct? Unless any other comments. I'm just thanking and grateful. All right, Bob, are you on the call?
Yes, I am. Thank you, Sarah. Really appreciate the opportunity. Next slide, please. Broadly, we have a number of things that we're focused on between now and the end of the year. There's even including a couple things that are not on this slide. We're focused on finishing the redesign of the fire implementation guide to support multiple domains, all the various domains that Sarah's currently working on and will be working on going into 2021. We're adding in the support, and we'll talk about this in the next slide, for surveys and assessments. We're supporting the various clinical activities related to social determinants of health and looking at how we exchange information related to each of those. Again, we'll have a slide on that, the next slide. We're planning to ballot the standard for trial use version 1 of the fire implementation guide in the January ballot cycle. I've included a note on here that it's important for us to remember that the implementation guide is a definition of how to represent social determinant of health information for exchange. It's not a standard for processing something internally. It's not a clinical workflow within an EHR. It's how we take information out of that and exchange it, in particular, based on the definition for a fire API conformant to the 21st Century Cures Act final rule that ONC has promulgated. We'll be creating a reference implementation. We'll talk about that in a second too. And we're planning for the January HL7 Connectathon 26. Next slide, please. As we look at the various clinical activities that we're trying to ensure that we can document for exchange, it includes broadly our ability to go and document and code social determinants of health data in conjunction with a patient's encounter. Those are the two items on the right-hand side in that stack. The ability to set social determinants of health related goals, and then to establish and track related interventions to completion. The ability to create them, the ability to communicate with community-based organizations, and be able to track the result of those. It's also our ability to go and look at how we use quality measures, for example, to measure the outcome of the interventions. And broadly, and you'll see that in the stack on the left, the ability to go and aggregate any of this data or all of it for reporting to appropriate other organizations that have the need to understand what has happened clinically and how to go and aid in intervention, whether that organization is a community-based organization, it's a public service organization, it's a payer, the ability to appropriately filter, aggregate, and exchange it. And in some cases, we'll be dealing with the identification of the information so we can use it for analytics externally. All of this is in the focus of consent from the individual to go ahead and have their information shared with those organizations or used in a particular way. Next slide, please. We went over this before, but I'm going to do it again because I think this is really important for our ability to go and automate the front end of the process. We're working with both Regenstrief on their LOINC tooling and with NLM on their tooling related to fire to go and be able to take any survey that we're working on. Sarah's had a list of those from food insecurity for housing, be able to LOINC code them and ultimately to add some things into them that are related to algorithms to appropriately establish health concerns, which ultimately can be promoted into problem lists or diagnoses. The ability to go and use the NLM, in this case, the LHC Forms widget, which we'll have to enhance a bit, to go and automatically take that panel that's been encoded in Regenstrief in LOINC and convert it into what's called a fire questionnaire. That's the basis in fire for going and interacting with an individual to go and ask a question and to go and record the response. We're also looking at enhancing their structured data capture questionnaire application, which is how we take that questionnaire and actually do the interactions. How do we display the question? How do we display the appropriate responses? How do we indicate if you selected one or more, depending upon the nature of the question? How do you go in and compute the resulting answer? For example, in the health vital signs, the third question is actually based on the first two. It's not a request or not a question to the individual, but rather a calculation. And then ultimately to produce a set of FHIR resources that'll be the basis for exchanging this information or for populating it into an EHR. That includes the questionnaire response. It includes the observation, which is really the recording of the question and the answer that came out of the survey, and ultimately to create a condition resource or a health concern that basically starts the process of interacting with the other clinical findings based on the provider's evaluation and creating a problem on the problem list, which is something that there's an intent to intervene on, or a condition or a diagnosis, and then establish.
I'll call it tomorrow.
So we've got some interesting things we have to work on here. We have to be able to, as I said, develop some additional tooling with Reagan Street, enhance some of the work that NLM has done, and then ultimately to be able to work on creating dynamic value sets so that we have the ability to support multiple domains within the context of one framework implementation guide. Next slide, please. One of the things we're doing this over the next couple of months is establishing a reference implementation. The goal of the reference implementation is to be able to show how this implementation guide would work in exchanging the information that we have talked about. How does that implementation guide go and look when you actually write code on both sides to go and extract the information, to structure the information, to ensure that the information is appropriately coded, to exchange it, accept it, and be able to do something with it. And so we'll be able to go and demonstrate the ability to go and have FHIR questionnaires line coded, create those questionnaire responses, observations, and appropriate health concerns, and then ultimately to aggregate and exchange goals and service requests, to be able to exchange service requests with community-based organizations, and to go and report this information as appropriate to organizations that have a right and need to know. We're also going to demonstrate the ability to support patient consent as part of the decision-making process, whether information can be exchanged or whether the exchange has to be accompanied by patient consent to indicate things that can be done with that information once it's received. Next slide. Okay, so this is the timeline for the technology roadmap. Basically, we have been working on the implementation guide for a while. The goal is to finish it up by the beginning of December. The January ballot is actually a month long. That starts about the second week, at the end of the second week of December, and goes through the second week of January. At that point, we go into what's called ballot reconciliation. We take the feedback that we've had from the ballot, and we start to go and decide what the disposition should be for each one of those ballot comments. Is it something we can incorporate? Is it something where we should change something? Is it something we defer to the future? But to address every one of the ballot comments, that's ballot reconciliation process.
Bob, there's a sorry to interrupt you. There's a specific question I'm wondering if you want to reference in the chat before it slips away regarding. It is so technical, I cannot assist you.
That's fine, we can do that. Will the population of the provenance resource be in scope for the computed observations and condition health concerns? That's a really good question. The provenance resource, as defined by ONC for this round of the 21st Century Cures Act final rule, is focused solely on the creation of information by a provider. It requires a reference to the organization, the date and time, but it's intended to be the organization the provider has worked at. We can take a look at that. What we've done as far as other efforts and accelerators is we've created some custom profiles on top of that base resource to go and indicate other sources of information. And we're going to have to probably judge whether we already have sufficient definition of, for example, the author and the time of authoring the information in the resource itself, or whether we need the provenance resource to support it. But it's a really good question.
And
So
then
we will look at that.
And then I just want to give a heads up. Although the meeting invite was only, I think, until 5, the meeting customarily goes until 5:30 when we're covering technical elements. So for those of you who are willing and able to spend the rest some more time in the call, we're going to finish Bob's technical presentation and go into USCDI with Mark. So again, I'm sorry. Just want to make sure that those who are willing and interested can stay with us. And then Art has a question on the as well, Art Davidson.
Okay, yeah, will the reference implementation include a mapping to the common CBO taxonomy, for example, 211 LA taxonomy? That's a good question. We'll have to take a look at that and see how far we can go. Remember, the reference implementation is an example of how this works. It wouldn't be a complete mapping under any conditions. It would only be for the things that we're going to show and demonstrate how one could exchange it. So we'll have to see how much of that we can do. And since that's not the only external taxonomy that could be mapped to, we'll have to decide whether it's going to be broader than just, for example, the 211 LA taxonomy. Let's see. Okay. So we can follow up on that. And just to go in, I'll take the branch and return right now. We have established a public call starting next Wednesday at 3 p.m. Eastern to go over the implementation guide, and we'll be having that call every week. It's a call under the patient care work group. It'll be on the HL7 calendar for those of you that want to go in and download it and put it on your calendars. But we invite you to come join us. And we'll discuss this and other issues on that call.
Yeah, and I do want to note that we are investigating very seriously a way to build a framework regarding assessments of what we're calling basically fire alignment. For those communities that are using existing structures of data exchange and proprietary, taxonomy such as 211 LA. We recognize the ecosystem here, and Bob and I have had lots of conversations regarding proprietary and non-proprietary taxonomies, and which coding systems they might be best in, and how to build a community of practice regarding solving that sticky wicket. And it is definitely part of why we're pausing and just kind of slowing down the goals and interventions work, because we need to make sure we get it right. So we look forward to all of your expertise and insight and wisdom as we try to make sure we do that elegantly.
Okay, thank you, Sarah. So finishing up on the timeline, we'll be building the reference implementation between now and the next Connectathon, which is on the row below in January. We'll be using that reference implementation as part of the Connectathon. We also show updating that reference implementation based on the ballot reconciliation. In other words, changes we make to the implementation guide will need to be reflected in that reference implementation. The intent is to take all of that back to the next Connectathon in May. Based on the outcome of that Connectathon and the outcome of the ballot reconciliation, we'll decide whether we need to make some additional final updates to the guide before we go to publication. So we're showing publication of the implementation guide in the May and June timeframe, or June timeframe. We're also showing the intent to start SDOH fire implementation guide pilots basically around the time we finish the ballot reconciliation. Depending upon your specific timeline, we could actually start earlier, as early as when the implementation guide has completed and gone to ballot. Or we could start as late as after the implementation guide publishes. Next slide, please. We participated in the Connectathon 25 Gravity track. We actually led that on September 9th through the 11th. The objectives were primarily to focus on the fact that we're creating a multi-domain implementation guide for social determinants of health, demonstrate how we can use link panels and NLM tooling to generate questionnaire responses, as well as the ability to generate observations and health conditions or health concerns or condition resources. That track was led by myself, Corey Smith, and Monique Van Berkum from the AMA. Next slide, please. We had 24 participants from 18 different organizations. We were able to go and demonstrate all of what we wanted to demonstrate. In other words, the ability to go and take a link-coded panel, demonstrate a questionnaire, be able to use that questionnaire to go and deliver the questionnaire using the NLM tools, and ultimately to go and be able to create the appropriate FHIR resources. We had to do some portion of that through hand coding because the tooling was not quite ready, meaning it could generate certain things like observations, but not generate the health concern or the condition resource without some manual intervention. But we're able to demonstrate that all that is possible and capable, and now we can focus on getting the tooling up to date to support it. Let's see, next slide, please. So what's next? We're going to engage with NLM and Registry to advance their tooling to better support multi-domain dynamic value sets. We're going to use their tooling to go be able to establish surveys, automate the survey process. We'll continue to engage the community to establish clinical content required for the multiple SDOH domains. We are starting the reference implementation guide development. We're working towards submission of ballot for January, and we invite you to come join us at the Gravity Confluence page and on our website. I think that's the end of it. Next slide, please. Okay, and again, we encourage you to come join us on our Wednesday 3 p.m. Work group or work call to work on the implementation guide and to go and solicit feedback from all of you regarding specific issues that we have in that implementation guide. I believe that is it. Do we have any more questions? No. All right, so at this point, I believe I'm handing it over to Mark to walk us through the work that we're doing on the USCDI submission.
Thanks so much, Bob. Next slide, please. So USCDI stands for the United States Core Data for Interoperability, and you've heard about this on previous calls. ONC, the Office of National Coordinator, announced that it was accepting submissions for version 2 through October 9th, 2020, and you see a link there to ONC's announcement. The Gravity Project will be making a formal submission of our collective work, and we've drafted a letter to support that formal work, which will include with the data element submission. All of the members of the Gravity Committee are invited to join the letter, and if you want to be added to this letter, please send your interest to the email address there. We've already received a good number of responses, so there's no limit. Just let us know. And on this call, I will be describing that letter for you. We have also, since August, invited the Gravity community to make your own submissions to ONC's draft version 2, building on the work completed through the Gravity Project for those of you who also want to submit the work yourselves. Next slide, please. So a little background on the issue, why this is important, what it means. On the left, the Common Clinical Data Set has been a set of structured data that ONC has required electronic health records to be able to exchange with a patient's, with information about the patient, usually with referrals or transitions of care, also to make it available to patients. You see the list there on the left of what that included. All of that on the right was not included. So in 2020, they made a few additions in what they changed the name to US Core Data for Interoperability, and that was version 1. And they added some things like provenance and clinical notes. But again, all of the other remainder were not part of it. And the most important thing to note here are the items in the lower right in red, the social determinants of health as ONC had listed them at the time. So these were not even scheduled. So when they might come in the future wasn't even a part of the plan yet. Next slide, please. So because of the groundbreaking work that you have all been doing as stakeholders and subject matter experts, the Gravity Project is positioned to submit an SDOH data class or USCDI version 2, and that's a big woohoo moment. We are focusing in this submission on what we expect we can have ready and fully vetted by the Gravity community in time for ONC's decision in the spring of 2021. So what you see here is what we plan to submit, but it's looking at the list of domains. You've already heard both Sarah and Bob talk about these. This isn't all domains that we've been talking about, but these are the ones in phase 1 and phase 2 that we expect to be able to support by the time ONC makes a decision. Others can and will be also added. On the activities, those are the ones that we've also been talking about. So the submissions will include those 6 activities, as well as the code sets and value sets that everybody has been working so diligently to come up the gap analysis, making sure that the submissions are in on time. For example, the one Sarah mentioned by December 4th, so that all of this can be put into place and implemented. Next slide, please. So a little summary of the letter. This will, again, it'll be October 9th. We will post a link to the letter on Monday so that you can take a look at it. It will be addressed to the National Coordinator, Don Rucker, include a little bit of background about the importance of social determinants of health, a reminder, if anybody needs reminding, that we've got to bring in the 80% of health status explained by what's going on outside the clinical setting. Most of the letter will be devoted to describing our submission. The submission is actually in the form of ONC's very detailed and intricate templates. We'll get all of that filled out. The letter will just summarize. So we're putting it forward to ONC in 2 different alternatives based on conversations that we have had with ONC. The first one will summarize it by domains such as food insecurity, housing instability and homelessness, transportation insecurity, et cetera. The second will organize it instead by the activities, the assessments, the goals, the interventions, the outcomes. Both alternatives will include the same material. It's just that we're organizing it differently so that ONC has both alternatives to consider. They've expressed some interest in each of them at different times. We're playing it safe by presenting both so that they will have everything they need to say yes. Then we'll cover a little bit about the need and maturity. They like to have some evidence to support saying yes to including it now, so we've got some evidence of that. We'll describe the importance of the Gravity Project as a consensus-based organization. All of the 1,200 plus people across the nation who've been participating in the calls, adding their expertise to make sure that we've identified gaps and gotten everything vetted well. We'll note that there are people joining the Gravity Project on the letter, all of you that wish to sign on. And come October 9th, those who've been on the team who've been working so hard, including all of you, to get this ready to go, we'll hit the send button and we will be grateful. Special shout outs to Joe Kliegman, our Cambria Grove Fellow, who has taken a laboring oar in pulling this letter together. Bob Dieterle and Sarah DeSilvi, both the technical and the terminology work streams, again, pulling all of your insights together into this letter. It will make a tremendous contribution because this is what makes it real in the communities when we get this through. So I think that's a summary. If there is time for any questions, Sarah, I'm happy to take them.
I think there are. And Mark, that was really elegant. Thank you so much. Lisa has a very apropos question that I actually think ties into our submission too. So Lisa is Nelson's asking whether it's possible to clearly request the assessment and plan data class in current USCDI V1 separate into 2 different data classes just because assessment and planning are different. And she's just noting that's crucial both for Gravity and the care planning work that's going on in conjunction with Gravity.
So I'll take a first stab. Bob may have greater insight. I'm going to, and it's a bit of a guess on my part. They tend to define things in a particular way. So if we are taking something that's a current defined standard and trying to tease it apart, we may have to go back and make that suggestion to ONC. But not sure. Bob, do you have anything that occurs to you?
Well, what occurs to me is our focus primarily is to get social determinants of health activities and code systems value sets in the USCDI. We need to really think about whether we're prepared to make a comment on trying to separate existing classes. When what we're really doing is focusing right now, at least in our submission, on creating a brand new class, which is really SDOH. We can have that. Let's just say we'll look at it. I don't know. I'm trying to figure out if that will create confusion in the submission we're making or clarity. So thank you.
It does tie in to the conversations we've been having back and forth regarding, as you can imagine, in the busyness of everything, Bob and Mark and Joe and Evelyn and all of us have been going back and forth a fair bit. But as a clinician, and Mike Klinkman also seconded this as well, it correlates to what we were talking about between health concerns and problems and diagnoses. We do have a request to go back to the 2015-2021 slide, just as a landing spot. So we have the letter here. I'm wondering if Linda, do we have time?
I think that's 2 slides back, I believe.
Yeah, that just for those of us who are not you. There we go. Lily, is that helpful?
And while we're looking at this, I just want to second what Bob said. I was answering more from the perspective of technical or policy possibility. Whether this is the time and whether this letter is the place to do it is a separate question, and we do have to be careful about that.
Yes, and Mike is activities seem different in kind and involve different user classes for data. I mean, you really need to think this through. Absolutely, Mike. So if you want to, yeah, Lucy, hi.
I wanted to comment about asking USDI to rearrange how they organize what they do. I would just suggest that asking a government agency to include a whole new data class and rearrange the way they do things is more than they will be able to handle and might undermine the viability of including social determinants. So I appreciate why this would be helpful at the endpoints that are going to use USCDI and use our work. But it's my experience, relatively limited, that you ask for one big thing and do the best you can to defend why they really have to take this big step and wait for the window to open to ask for the other big thing.
Yeah, this is Bob. I agree with you. I think that we have to be a little careful that we don't confuse the process that we're trying to create here, which is to make sure social determinants of health become part of the USCDI lexicon and part of what's being required for certification. There are going to be some really interesting issues in trying to tease apart some of the existing data classes, especially as it relates to other types of clinical data. So we'll look at it, but our primary goal here is to make sure that the social determinants of health data class and its appropriate representations become part of the USCDI lexicon.
It would really be front page news if we persuade them to do that.
I agree.
And we've got a good chance.
Yeah, everyone's been working. Yeah, and we definitely appreciate any focused comments on this. Is the first time we've been able to really demonstrate to you the plan and approach. And again, huge shout out to Mark and Joe and Bob, who've just put incredible hours into this. Just so grateful. So if in response to the plan, again, maybe go to the back to the letter page again. So in response to the plan, if you, or to the previous plan, if you have any specific thoughts, just send them in an email. And we have some more things to refine over the next days. But looking forward to your insight here.
Can I give a quick answer to Lisa on the
Yeah.
timing?
Yeah.
So ONC will be considering October to December, put out a proposal for public comment in January to April. We'll look at the comments and make a decision in May to June 2021. So the announced timeline looks like a decision by a public decision by say July 1st, 2021.
I think one of the things important to note, the ONC has made the decision this will be a recurring annual process. And so we'll have another, if you will, bite at the apple next year for things that we want to go and consider should be part of it, but may be secondary to the importance of getting the SDOH data class and its members in place.
All right. Any other thoughts on this lovely piece of work?
Just thank you to the community.
Yeah, I know. You guys are the best.
So we're all going to get an email on Monday with a link to look at this. Is that correct?
It is. I believe that's the plan, correct, Mark?
That's yes. Whether I'm not sure. Yes, there's a link, and I think it's by email, but we'll make sure it gets out to you, to everybody.
Thank you.
Okay, yes, we will send in community email, says Evelyn. Thank you, Evelyn.
Thanks, Evelyn.
All right. Next slide, I think. Are we on to, I think there's a few more slides, community homework next steps before we close it. We have 8 minutes to go. There's been a lot on this call. This is like one of the calls that really represents the breadth of what we do, right? We've covered everything from, our collaborations with our federal partners and innovative grant opportunities to the terminology development and the complexities of trying to build language to address human concerns. And then we segued into the technical build and the complexities of trying to build computable logic to share this information to improve interoperability. And then we went to the USCDI submission. That's the most meta gravity call I think we've had yet, right? So that's a little bit of everything. So think about homework for the next call. Again, generally just try to catch up if you're new to the group. It's clear that we do a lot together. So the confluence is a very robust, sometimes overwhelmingly robust set of information. Again, the call from today will be posted on there eventually. Please do vote on the housing instability and homelessness concepts. I will be sending out direct emails to individuals who have not voted but are committed members. Submit new concepts and review the inadequate housing element. You can see the summary page on the Confluence. Again, those end-to-end review comments are really critical. And then new concepts for transportation insecurity and financial strain. And again, I'm sorry, there's a little bit of a typo here. So inadequate housing is you can definitely submit new concepts, but it's also in its end-to-end review phase. So if you are reviewing this set and you feel like things need to be taken out, this is when to do that too. It's not just about adding things new. And then next slide, please. And then here you go. Next step, if you have not joined and you want to join the Gravity Project as a committed member or other interested party, please join. And then if you're joining right now, just know that if you want to take a quick review of the housing instability and homelessness data set and give us a vote, we'd greatly appreciate it. Any other thoughts before we close the meeting? No thoughts? What a stellar call,
Okay.
friends. Mike Klinkman says, woo! Yes, indeed. It was a big one. Thank you, team. Looking forward to seeing you in 2 weeks' time.
All right.
Thank you.
Thank you, Sarah.
Bye, everybody.
Bye-bye.
Bye, Lydia.